afternoon, doctor. My name is Eshika Paruchuri. I'm a 10th grader studying in New Jersey, United States. I am the founder of Healthy Teens. It is an initiative that aims to educate adolescents around the world. My main goal is to work with experienced doctors to talk about ways we can improve our health as teenagers. Meet Dr.Vindhya Vasini, who is an expert in the diagnosis and treatment of cancer. She specializes in providing compassionate care, utilizing cutting-edge therapies, and guiding patients throughout their cancer journey. She places personalized treatment plans dedicated to improving outcomes and enhancing the quality of life for each individual that she works with. Thank you, doctor, for joining me today.
Thank you. Thank you for having me.
Would you like to give us a brief introduction about yourself?
So, I'm Dr. Vindhya. I'm a senior consultant medical oncologist working with Omega since 2016. I did my MBBS from Andhra Medical College, Vizag, and then went on to do a DM in radiation oncology, following which I completed my super specialization in medical oncology. And since 2016, I've been practicing oncology, medical oncology, and I'm associated with Omega Hospitals.
Very nice. Firstly, let us start with what is cancer?
So, cancer surprisingly is an unusual development from the cells in our own body.
Mm-hmm.
So, it is not some foreign organism that comes, but it is the change in the normal cells that are present in our body. Mm-hmm. So, these cells, they become rogue cells. So, they stop listening to the orders of the body and they start dividing uncontrollably. Mm-hmm. And there are certain mutations that take place in the genetic material in those cells, which causes them to become immortal in a way, and that is how they form lumps or clumps of useless cells, and they start filling the organ in which they originate, and from there through the bloodstream or the lymphatics they spread to other parts of the body, and then that is how they affect the different organ functions, leading to stage 4 cancers and thereby death.
Okay. What are the symptoms of cancer and how do you usually diagnose it?
Unfortunately, in very early stages, most of the cancers are asymptomatic. That is, there are no symptoms that can be detected. Mm-hmm. But generally, what we say or what we preach is to identify certain changes in the body, mm-hmm. Which can caution us about the possibility of a cancer. Mm-hmm. One is the word caution itself. So C stands for change in the bowel or the bladder habit. When a person usually is used to passing stools once or twice a day, and now suddenly there is new onset of constipation where the bowel frequency or motility comes down, or there is a change in the pattern of urination, or a mole which is changing the shape, or any unusual bleeding. Mm-hmm. Especially say in women when there is a abnormal vaginal bleeding, when the periods have there is an irregular bleeding or spotting in between, mm-hmm. periods, or when there is a sexual interaction, there might be bleeding during that time, mm-hmm. or a thickening or lump anywhere in the body, especially a lump in the breast or in the axilla, armpits or neck. And more so when these lumps are painless, that is when this is more dangerous. So any painless lump anywhere in the body is more dangerous than a painful lump. And then indigestion or altered appetite, change in appetite or reduced appetite, unintentional weight loss. These are some of the signs and symptoms that might indicate possibility of cancer. So these don't occur only in cancer, but if someone observes these, there is it is always better to reach out to your physician and get yourself checked. There's also this nagging cough, the presence of dry cough for more than 3 weeks, which is also suspicious for several other conditions. Most common in India is tuberculosis, but apart from these infectious causes, cancers can also present, especially lung cancers can present with these symptoms. But most commonly being asymptomatic, that is absence of any symptoms is the most common presentation. That is how they present at a later stage.
Okay. What are the most common types of cancer that you come across in your practice as compared to the global data?
So when we look at the global data, the Globocan is the global data where they collect all the cancer related data from all over the world, and world over now breast cancer is the most common cancer that we see when we take into consideration the cancers both in men and women together, following which lung and GI cancers are also common. But when we look at the Indian scenario, here head and neck cancers are very, very common. In fact, India is known as the headquarters for head and neck cancers because of the rampant use of various forms of tobacco. Having said that, even in India, breast cancer is the most common cancer. When especially being a woman oncologist, I come across most of the gynec and the women related cancers, and in our area the most common cancers that we see in women are breast cancer, cervical cancer, ovarian and endometrial cancers. We do see lung and head and neck cancers in women. Lung cancer incidence is increasing because of the increased exposure to various pollutants in the atmosphere. So, and also industrial pollution. This has increased the incidence of lung cancer.
Okay. And typically, what is the survival rate for patients who have been diagnosed with cancer?
When we talk about survivals, the stage and type of cancer is also very important. Usually, the staging is done based on the survivals. When the cancer is diagnosed at a very early stage, say stage 1, the 5-year or 10-year survivals are much better, and the cure rates are much higher in these patients, of the order of 95% to 98% survivals. As the stage increases, say we go for stage 2, in these patients the survivals are slightly less, around 80% or 70 to 80% would be the survival. Stage 3, the survivals are even less, around 40% to 50%, and in stage 4, 5-year survivals are very, very minimal. But this is not common or same in all the cancers. When we take say hormone positive breast cancer per se, we have patients who are diagnosed in stage 4 and they survive for a decade or more because of the newer treatments available, newer targeted therapies. This is all possible because of the better understanding of the biology of the tumor, and we have better drugs available now when compared to a decade ago. Some cancers are very, very aggressive, and even if they are diagnosed at an operable stage, the chances of their coming back is higher, and such tumors, they behave aggressively, and it's basically depending upon the type of cancer and the biology which will decide the survivals. So not all stage 4 cancers have poor prognosis. There are nowadays the aim of treatment, newer treatment developments is to try and make cancer one more chronic disease like diabetes and hypertension. That is how in the future cancer might evolve into a chronic disease where the survivals are significantly improved with some form of maintenance therapies.
Okay. Do people get affected by a particular type of cancer based on the geographic location or food habits?
Yeah, this is a very, very important question, pertinent to especially migrant populations also. So when we look at Eastern Asia, there's a high incidence of certain cancers like nasopharyngeal carcinomas, cholangiocarcinomas. It's based on their dietary habits, and so in the Western countries, in the European and in the American, North American continent, GI cancers are more common because of high amount of red meat consumption in these populations, where because of low fiber and high red meat content, there is increased incidence of the colon cancers. And different pockets, like in India also we have the northeast states where the incidence of certain cancers like the gastric cancers and breast cancers is high. And certain ethnic groups like the Jewish community, it is known that they have, because of the inbreeding, there is an increased risk for certain hereditary cancers like the hereditary breast and ovarian cancers. In fact, the BRCA gene was first identified in this community, the Ashkenazi Jewish community. Because of the inbreeding, there was an increased incidence of breast cancers in these communities. And when they went and looked at their genomic makeup, they found a mutation in the BRCA1 and BRCA2, which are two genes which are known to cause breast cancers in families.
Okay, that's very interesting. And is there a particular age group that is at most risk for cancer?
So, like all chronic diseases or metabolic or lifestyle diseases, as the age increases, the risk for cancer also increases. And the general dictum is about the cancers are more common in elderly population, that is above 60 years. And in our country, in India especially, the incidence is seen a decade earlier, that is from 50 years age onwards, we see increased incidence of cancers.
Okay. How does cancer affect the health and development of individuals?
So again, when we talk about cancers in young adults, teenage and adolescents and infants and children, so based on the type of treatment that is given, the individual might require chemotherapy or radiation. This might affect their growth and development. So, especially when radiation is given to certain parts of the bodies like the spine, where the growth of that spine might be affected, there might be some developmental disorders like scoliosis, kyphosis. The vertebral bodies might have a deformity. There might also be mild mental developmental changes, which might not be that common, but more than that, the social impact, the psychosocial impact that a diagnosis of cancer has on a child, especially when they are very active and they see all their colleagues and peers are happily going to school and they are stuck with the treatment at hospital. That kind of a psychological impact affects more and they require more counseling and more sessions with the psychosocial analyst or the social workers to boost their morale and help them go through the treatment successfully.
Okay, so now that we're talking about the psychosocial changes, from your experience, how do parents feel when they get to know that their child is diagnosed with cancer?
So that is in fact one of the toughest situations as oncologists we also face. And nowadays all the most of the couples, they have limit one or two children in their family, and every baby, every person is precious, and especially so the emotional factors are high when the children are affected. And initially especially the mother, who is the main primary caregiver, the emotional support that she requires is very high. And a lot of the times they break down when we are giving the diagnosis. So because that is not what is normal. So kids are supposed to be healthy and they grow normally. It's more concentrating on their educational part. Now when especially when a cancer is diagnosed in children, there is a lot of not only emotional factor, lot of difficulty in accepting the diagnosis. And but fortunately, most of the cancers that are diagnosed in children are highly curable. Even the leukemias in children, the most common leukemias that we see is ALL, acute lymphoblastic leukemia, where the cure rates, especially when diagnosed below 10 years of age in girls, the cure rates are extremely high, of the order of 90%. with all the latest treatments available. Only thing is there is a prolonged treatment, year or two of treatment that is required, and this prolonged treatment requires a lot of emotional support to the family during the visits, and the child also needs a lot of psychological support, and at the same time they should not be missing on their normal milestones and normal life. So it is very very difficult, not only to the child but the family as a whole, when a diagnosis in a child is made of cancer.
Okay. When we talk about relapse, like when a person might regain a cancer, usually how does it work? Like, do patients undergo the same treatment, or?
So again, relapses or recurrences, the treatment for these depends on what type of cancer it is, when it has recurred, where it has recurred. The usually solid tumors, that is non-blood cancer tumors, they once if they relapse, and if the relapse recur in a particular area or in a limited place, and after a long duration of treatment free interval, then usually they respond very well to treatments. And if there is only one area where it has relapsed, now we usually commonly come across such scenarios where a person of breast cancer was diagnosed, treated, and on follow-up, say after 2 or 3 years, they get back a small lump or a nodule in the axilla, and there is no disease anywhere else. And again, we can do a curative treatment in them by doing surgery and then a local therapy, and if required, some chemotherapy to keep it in remission. Even in leukemias, which are very common to have a relapse, there are very good treatments now with the development of CAR T cell therapy, which is an engineered T cells. So with these newer techniques, then there is the transplant, stem cell transplants, and there are a huge armamentarium of newer treatment options, bispecific antibodies, all these bites, all these newer treatment options are emerging, and lot of research, lot of data, lot of bench to bedside translational medicine updates have been taking place. I think in the past 3-4 years there was a huge jump in the treatment options that we have, and the chance for cure future is looking very bright in these patients as well.
That sounds very promising. So now let's talk about your career. What is the best part of being an oncologist, and what is the worst part?
Yeah. So worst part is when a patient comes first with a diagnosis, then we have to break the news to them and then to their family. And when it recurs back, so during the course of treatment, there is a bond that is developing between patient and the doctor, and once we see that the patient has completed the treatment and is cancer free, announcing that news to them is the thing that we wait for, and to see the smile on their face and the sense of achievement that we have done something, achieved something by extending the life of such a patient or improving their quality of life. So when a new treatment has been approved and it works wonderfully in a patient, so for an example, we had this elderly gentleman, 68-year gentleman. He presented in 2022 January. With a huge mass in the esophagus and stomach. It was obstructing his food pipe. He could not take any food, even water. So we had to put a tube into his stomach, and through the tube we used to feed him. There were huge nodes in the abdomen. He was diagnosed as stage 4 gastric cancer. and he, based on his general condition and the stage of the disease, we gave him 6 months, and then we started him on radiation to just relieve this obstruction so that he will be able to at least take food orally for as long as he lives. And fortunately, after the biopsy, his tumor was suitable for immunotherapy, and immunotherapy was approved in his tumor in gastric cancer only in that year. He was in fact one of the first patients in India to be put on immunotherapy, and within 6 months the PET scans were all negative. Even now he comes once every 3 weeks for immunotherapy, and he's totally tumor free, cancer free, and it's been 3 years now. So January it will be 3 years. So I think such cases are the ones which keep us going. Though we are seeing more and more such patients coming up, and previously oncology was like a death sentence, but it is no more in that field. Now we do have treatment options. Even in stage 4 we have patients who are cured and having normal life. So there is tremendous improvement, and this is what keeps us growing.
That's very nice. You're seeing a lot of breakthroughs. And I think that's amazing. You said immunotherapy is now starting to become a practice in oncology. So what have you seen differently from when you first started in oncology to now?
So when I first started, like my journey in oncology started in 2008 when I joined my radiation oncology residency. So most of the patients that we see they presented with a very advanced stage diseases because of lack of awareness about cancer, and there was no facilities available in the peripheries, in the villages and remote areas, and people were not even aware about the word cancer. And if they had some lump, because it was mostly painless, they ignored it until it ruptured, it broke, and then it ulcerated, it was all fungating, and then it was a nuisance. That is when they approached a doctor, and that is when they got diagnosed, and by that time it was a very, very advanced disease. But now I think with the improvement in and penetration of the digital era into the even in the remotest areas, with the use of social media, the awareness, I would not say the awareness has penetrated 100%, but there is a significant improvement. There is a leaps and bounds of increase in the awareness. At least everybody knows, most of the population knows what cancer is, and there is a campaign going on in the social media, many campaigns going on in the social media, trying to raise awareness about cancer, the importance of detecting it early and how to detect, importance of screening. So all these have translated into detecting early stage cancers more and more. Previously we used to see stage 3, stage 4 breast cancers. It was a very rare incident that we see a very early stage mammography detected breast cancers, but now more than 20 to 30% of breast cancers are very early stage, detected by mammograms. So this is a kind of improvement that we are seeing, and also the newer technologies, newer treatment options, use of engineered molecules, which has improved the treatment outcomes and survival rates in these patients. All these are exciting times in oncology, I believe.
That's very nice to hear. So now I wanted to proceed to different types of therapies and techniques that have been used in medical oncology. So firstly, can we talk about what is stem cell transplants and how are they helpful?
So stem cell transplant, previously it was mostly used in leukemias. Now also we use most commonly in leukemias and myeloma, multiple myeloma. it is basically the stem cells are the progenitor cells, the cells which are in continuous division, and they are producing the various blood products like the red blood cells, white blood cells, platelets, different kinds of white blood cells. And these stem cells are they are present in the bone marrow, and they are like the mother cells from which all the cells arise. And especially in cases of leukemias, lymphoma, some lymphomas, and multiple myeloma, mostly hematological blood malignancies, they require a very high dose of chemotherapy to be destroyed. But when we give such high doses of chemotherapy, these stem cells are also destroyed. So what we do is we harvest these stem cells by stimulating the production of more and more stem cells. We give some growth factors which will stimulate the production of these stem cells in the bone marrow. These stem cells are collected from the blood and stored. And once the stem cells are stored, the patient is given very high doses of chemotherapy to kill the cancer. So this chemotherapy will not only kill the cancer, it will also kill the stem cells. So that is when these stem cells which are harvested are given as a rescue to the patient. It is basically a type of rescue to overcome the side effects of high dose chemos. So there are different types of stem cell therapies. One is the autologous, wherein the stem cells from the patient itself, they are harvested and then they are again introduced in their own body. Then there is allogenic transplant, wherein the stem cells are harvested from identical twin or a sibling or parent or an unknown donor. There is also nowadays we have the cord blood banking. Cord blood, the human placenta cord has is rich in stem cells. So when the cord blood is stored in ideal conditions, it can be used later on for the same person or their siblings or whoever matches with the cord blood. The stem cells from the cord blood can be used for transplant. That is how it now with the advent of newer therapies like CAR T cell therapy, BiTE therapy, the transplant is also moving into a later lines. So we are using more and more CAR T cell therapies which have shown very good responses in patients who had relapsed leukemias.
Okay. And what is immunotherapy and what is gene therapy?
So immunotherapy, I think it has made a lot of noise recently in the last decade. What does immunotherapy do is nothing but it's a simple action. So the cancer cells, they are very, very intelligent. They block the white blood cells in the body from identifying these cancer cells as rogue cells. So generally when the body's immune system is working well, our white blood cells, they identify these cancer cells or abnormal cells and kill them. But these cancer cells, very intelligently, they produce a curtain like thing and hide behind this curtain. And they are invisible to the white blood cells. The immunotherapy, what it does is, to say in a lay terms, it opens the curtain and exposes the cancer cells to the white blood cells. So these white blood cells attack the cancer cells and kill them. So that is how immunotherapy basically works. So it activates the person's own white blood cells and immune system against the tumor, and his own body fights and kills the tumor. That is how immunotherapy works. This is why there are minimal side effects in immunotherapy. Unlike chemotherapy, where we see a lot of side effects starting from hair fall in the blood counts, changes in the bowel mucosa, bladder habits, or weight loss. Lot of side effects are seen in chemotherapy, which is not commonly seen in immunotherapy.
Okay. And what is chemotherapy and radiation therapy?
So when we look at the various treatment options for cancer, there are local therapies like surgery, where we remove the organ. So radiation, it uses high energy X-rays most commonly, or it can use alpha particles, different types of radiations, alpha particle, beta particle, proton therapy, neutron therapy. So they basically are a type of local therapy where they release a large amount of energy into the tumor, and this energy will cause breakage of the DNA. It will damage the tumor DNA, and that is how it causes tumor damage, or reduces the tumor size. When we look at other types of cancer therapies, in medical oncology, we have chemotherapy, which is the oldest form of systemic therapy. Systemic therapies are, they're given either orally or through blood, and they work throughout the body. Wherever there is tumor, the blood circulates and it exposes this drug to the tumor. So chemotherapy acts on all rapidly dividing cells, and in a patient with cancer, the cancer is the most rapidly dividing cell. So it acts on the cancer. It also acts on other rapidly dividing cells like the hair follicle cells, the lining mucosa of the gut, and the blood forming stem cells in the bone marrow. That is why, along with the tumor death, there will be side effects of chemotherapy like hair loss, mucositis, fall in the counts. These are all the side effects because of the actions of chemotherapy. Now we also have other types of therapy like targeted therapies. These targeted therapies, they, as the name suggests, they target a specific receptor on the tumor. Like we have a HER2 receptor on the breast cancer, and if we give anti-HER2 therapy called trastuzumab, it goes and blocks the receptor and kills the cell. And other forms of therapies are like immunotherapy, then hormonal therapies, especially in some types of breast cancer, prostate cancer, endometrial cancers, we use hormone therapies to control the disease. And then we have all these CAR T-cell therapies, stem cell transplant, engineered therapies, antibody drug conjugates. Again, these antibody drug conjugates, they are also engineered cells where chemotherapy drug is attached to antibody targeted therapy, so that they go and target the tumor and release the chemotherapy in the tumor, causing more cell kill. So all these newer techniques have also improved the method of delivery of the cancer therapies, thereby increasing the response rates, reducing the side effects, and improving. Our goal is to improve survival.
Okay. So now let's move on to daily things that we can do to prevent the diagnosis of cancer. What kinds of foods should we avoid?
Yeah, I think this is a very pertinent question. When we look at the various risk factors for cancer, lifestyle changes. Lifestyle factors are one of the most common risk factors. In lifestyle, apart from alcohol and tobacco consumption, food habits play a very important role. Nowadays we see consuming high calorie dense food is very common. The fast food sections are always busy, and all the kids, they are attracted, they always want these pizzas, burgers, or pastas, whatever, and then they don't take the normal fiber rich foods. So consuming these fast foods once in a while is harmless, but they do have lot of calories, lot of salt, lot of processed foods, processed ingredients. So the more the processing, the more is the amount of preservatives, chemicals, which they interact with the cells in our body and increase the chance for mutations, increase the chance for cancer development. And avoiding these fast foods as much as possible, taking lot of fiber. Fiber is commonly seen in all kinds of vegetables, fruits, including different colored vegetables and fruits in our plate is a good way of improving the fibers, flavonoids. These are antioxidants. So the antioxidants, they prevent the damage to the DNA that normally occurs as one ages, or when there is a lot of stress in the body. So including such foods will improve or reduce our risk for cancer is one. Not only cancer, many of the lifestyle diseases like young onset. We see very young children even in their teens getting diabetes nowadays. A lot of obesity around. All these increase the risk for cancer also. So later on they will reflect in the increased incidence of cancer. So including lot of fiber diet, lot of fruits and vegetables in the meals, and reducing or cutting down red meat. Red meat is like the mammalian meat, goat meat or beef, or all the mammalian meat is a red meat. Chicken and fish are good meat. So having chicken, fish or egg whites is a good source of protein. Better avoid red meats. So this is what they can change in their diet habits.
Okay. And what impact does alcohol and other types of substances like tobacco have on?
So around 70% of the cancers that we see are preventable, and they're caused by either smoking tobacco or alcohol. Tobacco can be smoking, chewing or any other form, and they have around more than 1,000 carcinogenic chemicals in them, which increase the risk for cancer starting from the mouth to the anal canal and the urinary bladder, kidney. So many cancers are increased risk for so many of the cancers with the use of this. And when tobacco and alcohol are combined, it is like a boom, like it has a super additive effect, and there is an increased multiplied increased incidence or risk for cancer development, especially oral cancers, lung cancer, pancreatic cancer, gastric cancers, several gastrointestinal cancers. The risk increases when these two are combined. Liver cancer. So majority, more than 70% of the cancers are caused by consumption of these two, and cutting down on them, like no absolute zero tobacco and cutting down on alcohol will significantly reduce the risk for cancer.
Okay. And is there any other advice that you would give to teenagers or the young adults?
Exercising. Nowadays, especially in India, because of this huge competition, kids are they are forced to study for long hours, 10-12 hours of study, and there is zero exercise, and there is increased risk for obesity in them. Even the WHO has suggested or advised to have at least 150 minutes of strenuous exercise every week, equally spread over 3 to 4 days in a week, to reduce the risk for various lifestyle disorders, including cancer. And the other most important thing, it's like the white elephant, the elephant in the room, which no one talks about, is the stress. The amount of stress, especially teenage children and adolescents, they go through this has a lot of toll on their immune system. Stressful situations or prolonged situations of stress, they will reduce the immune system, which later on turns into or reflects as increased risk for cancers. Not only cancers, different other lifestyle metabolic disorders, diseases. So being stress free, having enough sleep, especially being away from the screens for at least 2 hours before sleep. So there is a hormone called melatonin, which is required for a deep sleep or a good quality sleep. And when our eyes are exposed to light before sleeping, the melatonin secretion comes down, thereby causing sleep disturbances. And these sleep disturbances, they translate into hormonal changes, hormonal imbalances, which later on they are the reason for various metabolic disorders and development of cancers. And it has been proven by several researchers that avoiding any light before sleep, at least an hour before sleep, and even sleeping in extreme complete darkness, not even a bed light, that is more healthy. And having good sleep, at least 7 to 8 hours of undisturbed good quality sleep is what is very important. And nowadays I think with a lot of use of the social media, even many children, they are unfortunately they have become slaves to this social media scrolling and that is taking a lot of toll on their health.
Okay. So now we have concluded our first set of questions. We will proceed to our myths section. So, firstly, cancer is always painful.
So as I've told, most of the cancers when they present as painless lumps or painless ulcers. We see a lot of smokers who present with a small ulcer on the tongue, and because it is painless, they're not bothered about it. And once it increases in size or spreads to the neck nodes and they see swellings, or once it has become more advanced, that is when the nerves get involved, and that is when pain occurs. So once there is pain in a cancerous lump, it means that it has already become an advanced stage disease. So painless lumps, again and again I want to emphasize, painless lumps are more dangerous than painful lumps.
Okay. Cancer is contagious.
So I think there is no, it's the farthest from the truth. Cancers, unlike infectious diseases like tuberculosis or any viral disease like the COVID, they're not contagious and they don't spread from one person to other person. And the caregivers, many a times we do get queries from the caregivers telling that they have kids in the house and is it okay for the patient to be among them. And it should be remembered that cancer is not contagious. It doesn't spread from one person to other. And even if we sit in the common room and eat from the common plate or sleep together, it is not going to spread from one person to other.
Okay. Eating sugar makes cancer grow.
I think this is a myth that has rampantly spread. It is a quick spread. Thing is, cancer requires lot of nutrition, and it will take the nutrition of, even if we don't take sugar, it knows how to get its nutrition from the normal blood circulation. So eating sugar doesn't increase cancer, but nonetheless it is always good to avoid refined foods, especially these sugar, jaggery, honey. Anything in excess is not good for any person, but it doesn't increase the risk for cancer, or it doesn't increase the growth of cancer.
Okay. Surgeries and biopsies spread cancer.
Yeah, we do come across such questions, but there is no data to say that when we biopsy a tumor, there will be an increased risk for the spread. And it is mandatory to do biopsies. Of course, in some types of cancers like ovarian cancers where the tumor is well encapsulated, we try to remove it as a whole by doing a surgery rather than doing a biopsy.
Okay.
In such situations, we do a surgery and remove it as a whole. But biopsying, say, a breast lump, doing a biopsy of a breast lump, it is not encapsulated. It is already spreading like, cancer is like a crab. So it has its tentacles spread all over. Just taking a piece from it doesn't increase the risk for spread of cancer.
Okay. Only women are prone to breast cancer.
So I think this is another myth that is circulated, especially in families where there is breast cancer also. Whoever has a breast will have a risk for getting the cancer, and breast is there for both men and women. And of course the breast tissue is more in women, that is why the risk of breast cancer is more in women. Having said that, in families where there is a genetic risk for cancer, that is in families where the BRCA mutation runs, especially the BRCA2 gene mutations, there is an increased risk for male breast cancer. And when a male presents with the breast cancer, we should check for this mutation, and all their family members should also be checked. So anybody who has a breast can get a cancer in the breast. Females, because the breast tissue is more, it is more common in them.
Okay. So we have concluded our myth section and also our podcast. So I would like to thank you again for being on this podcast. It was an honor having you. We've talked a lot about cancer and its effects and how prevention matters. Thank you for your time, inputs, and contribution, Doctor.
Thank you. Thank you for having me.
So we have reached the end of our podcast. Thank you for being here with me. It was an honor having you. We have discussed a lot regarding cancer and how prevention really matters. I had a very fun time discussing all of this with you. So for our viewers, we have a slogan from our doctor.
Nourish your habits to flourish your lifestyle.
Thank you, Doctor.
Thank you. Thank you for having me.